when I was in Belize, I heard on the radio, over Radio Free America, about what was going on in Kosovo back in 1999. That's what it was. And when NATO got involved, I knew I had to go there next. So when we returned home that summer, I began working toward finding a position to go to Kosovo. I went with International Medical Corps. They're a really good organization. They work practically everywhere in the world if there's been a war or a natural disaster. But my job on that, it was very intimidating. My job was to train doctors and nurses in providing prenatal care. I knew when I was going it was going to be maternal child, and I knew it was education, but that's all I knew. And that can mean a lot of different things. And when I got there, and the first day, I was told, you're going to be training doctors. You can imagine my how intimidated I was by that. I thought, I'm a nurse practitioner. I'm going to train doctors. How is that going to work? But it was because of their lack of training. The training these doctors had trained under for the past 20 years, prior, had been what I call homeschool medical school. It was illegal. All Muslim Albanians were not allowed to attend university when the Serbians took power. So they formed their own, and they taught in garages and basements and open fields. And school was taught by doctors, the older doctors, but it was real hit and miss. I'm not even sure there was a set curriculum. It was like, this doctor would show up and teach for a week what he knew, and then they'd have to move where they were going, and a different doctor would take over. It was very haphazard, and certainly not what we in the United States consider to be medical school. But at the end of the training, they were considered doctors and giving a certificate that said so. Prenatal care, OBGYN, was not at all a part of their curriculum, ever. It didn't happen. So everything I had to teach them about that was new. And as a woman's healthcare nurse practitioner, once I understood all that, it made sense. Sure, there was a lot I could teach, and they were just hungry to learn. They worked so hard. I mean, we would do clinic, and then they would go home and study, and then while they were studying, I was planning the next days. It was like we were doing clinic, much like nursing school is now. You go to clinic, you go to class, only we did it all in one day, and then I go home that night and plan the next day's class, because it was just very intense, and I had only 4 months to finish up this program that had been going on for about 6 months. We were running out of funding, so like a one-year plan, I think, was the thing. And it was an amazing experience, though. It really was.